Hi everyone, I'm Dr. Smita and welcome to Baby Doc once again. I hope you're all staying home and taking care of yourselves. Today I'll be talking about febrile seizures because I feel that it can be very scary for a parent, to see your child seizing in front of you and not knowing what to do. So in this video, I'll be talking about the steps that you need to take when your child is having an episode, and there'll be a lot of medical terminologies used in this video because this is a very complex issue, but I'll try my best to explain it in common words also. And before we get to the actual part, I think you should have a quick overview of what febrile seizure is. So let's have a quick look. By definition, a febrile seizure occurs in temperature more than 38 degrees Celsius or 100.4 degree Fahrenheit or higher in children of 6 months to 5 years of age in the absence of any CNS infection, that is brain infection, or any acute electrolyte imbalance, and without a prior history of afebrile seizures, that is seizure without fever. Now the most common age, as I said, is 6 months to 5 years, but we have seen cases where the child is less than 6 months or more than 5 years also having febrile seizures. But the first febrile seizure, that is the onset beyond 7 years of age, is highly unlikely, and this definition is for you as a parent for a better understanding and not self-diagnosis of your child. Let's have a quick look at the two basic types of febrile seizures, that is simple and complex, where both occur in temperatures more than 38 degrees Celsius by definition. In simple seizures, the age is strictly 6 months to 5 years. It's usually less than 15 minutes in duration. It is generalized, that is the whole body is involved, and usually the no recurrence is seen, that is in 24 hours only one episode occurs. Whereas in complex seizures, the age can be less than 6 months, but has to be more than 1 month of age, that is in newborn period. We do not see febrile seizures, or it can be more than 5 years also. It may last more than 15 minutes. It can be focal, that is involving only one part, or it can be generalized. There can be multiple episodes in 24 hours, and it usually amounts to almost 20 to 30% of all febrile seizures. Now the next question that you may ask as a parent is, why does febrile seizure actually occur? So the mechanisms are very complex, but I'll put it very simply for you that when there is increased temperature, it excites your brain cells. Also, it releases a lot of cytokines in your body, which are basically fighter warriors, and this also leads to brain cells excitation. And the increased temperature per se leads to increased respiration, that is the child starts breathing fast, and this leads to a chemical imbalance of your blood, which also triggers your brain cells excitation, and this is why a seizure occurs. Now, as I said, the mechanism behind febrile seizure is very complex, and I tried to explain to you the chemical aspect in simple words, but there are other factors like neurodevelopmental factors, environmental triggers, as well as genes which play an important role, and that's why it's almost impossible to predict whether your child will have febrile seizure or not. But if there is a family history, that is either parent or a sibling has suffered from febrile seizure, the child is also likely to suffer a febrile seizure, but there is no 100% rule that the child will also have febrile seizure. And the most important question that parents worry about is that will it reoccur, that is after 6 months or 1 year, say, again the child will have a seizure or not while having another episode of fever. So this is also almost impossible to predict, but there are chances of recurrences, and that is why one has to be cautious. Let's see what you need to do when your child is having seizure. So first of all, do not panic, stay as calm as possible, and position the child, as you can see in the pic, that is onto the side and not on their back or on their stomach. Loosen their clothes, protect them from any fall, and do not place anything in the mouth, which is a very, very common practice that people do. And these measures will ensure that your child will not aspirate, that is the stomach contents, whatever is there in your child's stomach will not go into the lungs during the seizure. And usually the febrile seizure are self-limiting, that is they stop on their own within 2 to 3 minutes. But if they do not, that is they last more than 3 to 5 minutes, you need to use the midazolam spray into their nose, And this midazolam spray is prescribed by your pediatrician once your child is diagnosed with febrile seizure. And since the dose is weight specific, I will not be mentioning it in the video, and they are readily available in the market, but you need a doctor's prescription and consult. And if after using it as prescribed by the doctor, the seizure does not stop, you need to take your child to the nearest hospital. Now, usually in my videos after the treatment part comes the prevention, but unfortunately, as I said, there's no way of predicting whether your child will have a febrile seizure or not. There is absolutely no way of preventing a second episode. But then again, when there are repeated episodes of febrile seizures, we do treat them with a short course of anticonvulsant, that is seizure stopping medicine, along with paracetamol for a course of 2 days. And as I said, it's very specific, so it's not for something for you to decide. It's at the pediatrician's discretion, and you should not medicate themselves on your child on their own. Now, another genuine question that parents have is that if their child has suffered from febrile seizure, will they go on to develop epilepsy? Now, in simple febrile seizures, no such risk is seen, but in complex febrile seizure, some of the cases might go on to have epilepsy, and that is why a complex febrile seizure should always be thoroughly investigated and then labeled as complex febrile seizure or epilepsy. And then they do need medications on a long-term basis, some of them. So in short, whenever your child has had a febrile seizure, the first episode, take your child to the pediatrician, diagnose completely, let the pediatrician diagnose it as febrile seizure, and then follow the steps that I mentioned in this video. Just don't blindly follow it. And another genuine question that many of the parents ask is whether the child, there'll be any brain development issues, or will the febrile seizures affect the IQ of our child. So the answer is no, there is no such effect on your child's brain development. But as I mentioned, if your child has complex febrile seizures and they are very repetitive and they are not treated properly, because they occur for a very long duration, they might leave some impact on your brain development. And since this topic is very specific, I'll not go into much details and worry you, but this is the gist of it. And you might also want to ask that what are the risk factors which can tell you whether your child will have a second episode or not. So there are 4 or 5 risk factors that have been known from all these studies all these years, and that is if a child is less than 1 year and has had a febrile seizure the first onset, that is if there's a strong family history, if your child has had a low grade fever and it's associated with febrile seizure, that is say maybe 99.5 degree Fahrenheit or so, and if the duration between the seizure and the onset of fever is very short, that is your child has had fever in the morning and by 2 or 3 hours there's another spike, and again there's a there's a seizure or something. So these are some of the factors which are considered as risk factors for your child to have a second episode. So this brings us to the end of the video, and as usual I think I've answered all of the questions, but if you have any, please do feel free to ask and questions, and please consult your pediatrician whenever in doubt. So until I'm back with another informative video, thank you and take care.